Good afternoon, everyone. Scott Maybor here, out on the beach, Monday afternoon. Hope you all had a nice weekend, and for those who celebrated, a nice Easter with the family, or whatever family you could do during these COVID times. Just got an email from a client I've mentioned before. She had a supplement in Massachusetts from a carrier that was charging her about $230 a month for a core supplement, which is the cheaper of the two. She came to me in March. Too late to change her drug plan because it was already past her open enrollment period, but we can switch supplements anytime. So we switched her to a cheaper supplement, saved her about $100 a month for the exact same coverage from an equally or better known carrier. Same exact coverage, saves her $100 a month approximately. And we applied for something called Prescription Advantage, which is a government program to help middle income people with drug costs. The Prescription Advantage comes with another benefit. In addition to lowering drug costs, it gives you an open enrollment period. So she emailed me today that said she just heard that the Prescription Advantage was approved. So now she can, if she still wants to, change her drug plan. That was an issue as well, but there was nothing we could do about it. Now we can make a change anytime for effective the 1st of the following month. So if we change it this week, May 1st, she'll have a new drug plan, which hopefully saves her a bunch of money. So that was one thing, always nice to hear, and everybody basically should have Prescription Advantage unless you're on Mass Health or low income subsidy, or you're just not going to qualify because your income's over about $60 a year. But everybody else, apply for Prescription Advantage. It's free and it's helpful. The other thing I wanted to mention is now that we're in kind of this period where there is no open enrollment, most of the people I deal with are new to Medicare. And I have a lot of people who tell me, well, I was referred to you by a friend or my financial planner or whomever, but I'm going to continue to work. My spouse is going to continue to work. We really don't need to know about Medicare because we're going to stay on the company plan. And that's fine. And that may ultimately be the choice. But my argument would be that if you're 65 years old or approaching your 65th birthday, you owe it to yourself to at least understand the rudimentary parts of Medicare, just so that you understand. Things change, people get laid off, companies close, people unfortunately become ill and can't work any longer. It's good to not have to be surprised by Medicare when it turns out you need it. And that way we have a follow-up conversation. We have an initial conversation. I run through Medicare in 15 minutes, and you say, great, okay, when I'm ready, I'll call you. When that time comes, or ideally a couple months before, we do a review. Then we can get into the nitty-gritty and talk about who your doctors are, what medications you take, who's your pharmacy, where you live. And then we can figure out the best plan for you. But we don't have to get into any of that early on. All I would recommend is understand what Medicare is. I mentioned that guy previously who was on COBRA for the past 18 months, who now has to pay a lifetime penalty on his Part B as in boy and D as in David for the rest of his life, and on his wife for the rest of her life, because they were on COBRA rather than be on Medicare. Easy mistake, and the company paid for the COBRA. So there's all kinds of these little mistakes you can make that can end up costing a ton of money that we could just review, and I could just simply say, don't go on COBRA, and there you go. Hopefully that just plants a seed. Don't sign up for Part A if you have an HSA, a health savings account, because they're not compatible. If you get audited, you'll owe penalties for deductions you weren't entitled to. So just, if you know somebody or yourself is turning 65 in the coming months, let's just have a conversation. You certainly don't have to go on Medicare for me. You may decide it's better than your employer's plan. In many cases it is, especially if you're covering just yourself. If you're self-employed, I guarantee you'll be dancing in the streets. But everyone should know about Medicare, because sooner or later almost everyone's going to be on it. And I'm happy to help. People who are low income can pretty much change every quarter. So certainly, and if you know somebody in that situation who wants to review their plan, they're always in open enrollment basically. So let me know how I can help. Have a great day, everybody. Be well, stay safe.